Albany, New York. In a bold move to overhaul New York's mental health care system, the New York State Department of Mental Health, alongside the Trump administration, has announced plans to phase out assisted living programs, including assisted living apartments. The controversial decision will affect thousands of residents across the state who rely on these services for daily care. As part of this new plan, state-funded facilities like East House and DePaul will be restructured into large residential living communities akin to group homes. These new communities will consolidate into massive housing units that will house up to 30 residents each, all under a highly regulated schedule. In an attempt to manage costs and restructure services, each community will operate under a strict policy where residents will be required to work in exchange for their housing, meals, and care. The state and federal governments will no longer be providing free services to individuals living in these facilities. Residents will be assigned jobs, and their daily lives will be closely managed. According to sources close to the Department of Mental Health, individuals will receive minimal free time, with much of their time devoted to scheduled activities, work, or other mandatory duties. Instead of a hands-off model where residents receive housing and care without any obligations, we will implement a system of personal responsibility, said a spokesperson for the Department of Mental Health. Residents will have to earn their living and demonstrate accountability in a controlled, regimented environment. For many who depend on assisted living, this new approach has raised concerns about the quality of care and whether individuals with mental health issues and disabilities will be able to adapt to this high-pressure system. Critics argue that this change could lead to further stigmatization and neglect of vulnerable individuals, particularly those who are unable to work or comply with such strict rules. Additionally, as part of the consolidation process, facilities like Costco, which have previously served as meal distribution hubs, will also see major changes in how they operate. They will provide meals to the newly established living communities, but only under strict guidelines that will require residents to follow predetermined schedules. The move is expected to save the state money, but at what cost to the well-being of its residents? Under this new system, residents will no longer have the same level of autonomy that they did under previous assisted living models. The program promises a more regulated and controlled living environment where free time is limited and all activities must adhere to a strict routine. As these changes take effect, many are questioning whether the true goal of these policies is to reduce costs, or if it's an effort to reshape mental health care into a more rigid and less supportive system. The road ahead remains uncertain, but one thing is clear. For residents in New York State's mental health programs, their lives are about to become far more structured than ever before.